Hi, my name is Megan O'Keefe, and I'm the Executive Director over here at Caregiver Volunteers of Central Jersey. We are a nonprofit organization who provides supportive services to the homebound elderly to help them age in their homes as a part of their community. Our organization started as a coalition of 8 churches who wanted to help families address the challenges of caregiving to their elderly loved ones and deal with issues surrounding social isolation. So what started as a coalition of 8 is now 80 congregations strong with over 1,000 volunteers active in their communities in Ocean and Monmouth counties. We know how important it is to connect with you, our partners in healthcare, to ease the burden of social isolation among the homebound elderly that we serve. So, what are some of the types of programs that our volunteers offer? Well, we have transportation to medical appointments. We provide food shopping both in person and online. We do friendly calls and friendly visits to offer companionship. We have certified pet therapy dogs that can come in for weekly visits or bark breaks, as we like to call them. We offer also a series of respite for those dealing or caregiving for a loved one with a longer term illness or has dementia or Alzheimer's. So this way we can give those caregivers that much needed break. We also have an intergenerational music therapy program as a part of our respite services. When we can, we like to provide services vet to vet because we know how important that bond and sense of community among the different generations of veteran is. We also have 27 different languages represented in our database of volunteers. So, in most cases, we can provide services that are linguistically appropriate for our clients. The goal of our programs is to ease the burden of loneliness among the homebound elderly, whose shrinking support networks make them more vulnerable to the health risks associated with social isolation. Our volunteers serve as the bridge to that social connection, so it's more than just a ride, a food shop, or visit. We match seniors and volunteers based on a variety of factors and common interests, so they're really able to form a bond and friendly connection. And that elderly homebound person has regular contact with someone in their community. All of our volunteers are vetted and go through background checks to ensure the safety of all the seniors who receive our services. While it's important to note that our volunteers receive aging sensitivity training, they are not medically trained. Our programs are truly meant for socialization. So our volunteers would not be able to administer medicine, do any cleaning or housework, or help with bathing or personal tasks. This would be outside the scope of our services. So as one of our partners in healthcare, we ask you to let us know if you know anyone who's over the age of 60 who's no longer driving that you think could benefit from our services. It's so easy to make a referral. You can just give our office a call at 732-505-2273. We'd be happy to help. Thank you again for your partnership as we both try to ease the burden of social isolation among the elderly in our communities.